Why does patient adherence to antihypertensive therapy matter so much? Well, it's a critical component in managing high blood pressure and preventing serious complications such as heart attacks, strokes, or kidney disease. Firstly, it's important to be vigilant about potential signs of patient non-adherence. These might include missed appointments or no substantial response to antihypertensive medications. Recognize that certain lifestyle patterns and habits, like a high-salt diet or excessive alcohol use, can also hinder the effectiveness of antihypertensive therapy. The goal of therapy should be clearly established to reach the target blood pressure with minimal or no side effects. Patient education plays a vital role in adherence. Patients need to understand their condition and its treatment. They should be involved in decision-making processes about their medications and lifestyle changes. Family support is often a key factor in improving adherence. Maintaining consistent contact with the patient can encourage adherence. Encourage visits, phone calls, or electronic communications with allied health personnel. Involving the pharmacist in monitoring the response to therapy and adherence can be beneficial. Feedback on home blood pressure readings during office visits and between office visits can be particularly useful for patients with uncontrolled hypertension. Ask about adherence in a non-judgmental manner and explore if any medication doses are missed. Acknowledge that medications can be expensive and have unwanted side effects. If patients do not return for scheduled appointments, make the effort to reach out to them. Keeping care inexpensive and simple can also improve adherence. Minimize the workup needed to rule out secondary causes. Obtain follow-up lab data yearly unless more frequent checks are necessary. Use home blood pressure readings, non-drug therapies, and the fewest daily doses of drugs needed. Tailoring medication to daily routines and using generic drugs can also be helpful. When prescribing, adhere to pharmacologic principles. Add one drug at a time. Use longer-acting drugs with less peak-trough blood pressure lowering variation, and start with small doses. Medication should be taken immediately upon waking up in the morning or after 4 a.m. if the patient wakes to void. Titrate gradually, especially with beta blockers. Anticipate side effects and adjust therapy to alleviate those that do not spontaneously disappear. Continue to add effective and tolerated drugs stepwise and in sufficient doses to achieve the goal of therapy. Involving a case manager, pharmacist, or nurse to identify and suggest solutions to barriers to adherence can also be beneficial. In summary, improving patient adherence to antihypertensive therapy involves vigilance, patient education, consistent contact, affordable and simple care, and careful prescribing. It's a team effort, and each step is crucial in managing high blood pressure effectively.